This is still now a lot of stigma to infection diseases, not only for HIV, because infection diseases, they mostly in poor countries, poor people. That's why many stigma. And if you want to be infection diseases doctor, you must understand that, for example, your patients mostly will be poor patients with social disaster patients. And you never will earn money, for example, orthodontist. If you want to be infection diseases doctor, you really have to love infection diseases, and also you must love people.
From PHI Media, I'm Gordon Thane, and this is Combating HIV/AIDS in Ukraine, episode 220, The Infectious Disease Detective.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Infectious disease doctors are often referred to as medical detectives, one who investigates clues from a variety of sources to then put all the pieces together to identify a root cause. There are many infectious disease physicians across the globe, each with a unique career path and areas of interest. Dr. Yaroslava Lopatina is one of these, and she has worked as an infectious disease doctor for HIV-positive patients at the inpatient department at Kyiv Institute of Epidemiology and Infectious Diseases. What you'll hear in this episode is Dr. Lopatina's inspiring journey to become the country program director for the AIDS Healthcare Foundation in Ukraine, starting with memories in her high school career classes. Dr. Lopatina, welcome to the Public Health Insight Podcast.
Hello.
Thanks for joining us. Very excited to talk to you about HIV/AIDS in Ukraine, especially in the global context. There's so many different regions disproportionately impacted by HIV/AIDS. Each situation is a bit unique, so we're really excited to dive into that. We're going to take a bit of a detour before we get there, and in the spirit of understanding who you are. Right now, you practice as a medical doctor. You're very involved in public health in Ukraine, especially with HIV/AIDS. But we want to know where it all started. The first thing I want to know from you is, what gave you that interest to want to pursue medicine? Was it sort of a family thing? You have doctors in your family, and that's been something that you've always wanted to do? Was there a specific moment in your childhood that made you think, yes? Walk us through that.
Yes, thank you very much for inviting me for this podcast. First of all, when I was in high school, there were organized some career-oriented classes for us, and we could try to do something to understand what we like or we don't like. I was in hospital, and in hospital my responsibilities was to help nurses to care for patients. There were inpatients, and mostly there were elderly people. And I saw when we came to their hospital rooms, they were very happy that so young people wanted to be doctors in future. And I understood that medicine is not only about pain or suffering, but also this about sea of human resilience, gratitude, and positivity. So I understood that medicine quite good for me. And then when I was in medical university, and our infection diseases course started, I fell in love in infections because I don't know what more interesting that than infections. For my point of view, infections influence much more on world history development, much more than maybe Morganic Marys or wars,
Right,
even wars. They look like detectives. When
Yeah,
you
yeah.
read detectives or novel, a romantic novel, but infection disease is much more interesting.
Was it something about, I know I was always interested in infectious disease too, and I wanted to eventually become a doctor, and infectious disease was big for me. Bacteria, how it works, and the viruses, how it evolves, how it affects humans, spread from one to the other, the selection. It was very fascinating for me. I like the word that you use as an infectious disease doctor. It's like a detective trying to understand the case and not just a particular patient, but how it spreads from someone to the other, tracing down patient zero. It sounds like a very fulfilling, exciting work to do.
Yeah, yes, and why one infection can provoke, some people can die from this infection, and other people even not feel this infection. So why this happens? So I was very interested in this, and I continue to be interested in infection diseases because people thought that we overcome infections, but this is not truth, and we far from infections. And COVID-19 show this very well.
Dr. Lopatina completed her medical training during the emergence of the global HIV/AIDS crisis. Reflecting on those early days, she shares her first-hand experiences working with patients affected by HIV and other infectious diseases. These encounters with different patients shaped her understanding of the human side of healthcare. So you went to school, you became a doctor, you had the courses that exposed you to infectious diseases and infectious disease medicine. Tell me what your first experience was like. So you talked about your experience working when you were in high school and there was those career classes and you were able to work with doctors and nurses. What was your first experience like when you became a doctor and you first started working in the area of infectious disease? Did it match what you hoped your vision was? Was it exactly what you thought, or was it a bit different?
No, it was not different. For me, I understood that more interesting than I expected.
Okay.
Yeah, and when I was a young doctor, I started work in hospital department. There were a lot of diphtheria in Ukraine that time. We care for patients with diphtheria. Uh, it was not dangerous for me because I was vaccinated, but sometimes it was very difficult because some people died, unfortunately, because they were not vaccinated and they died. Then it was coincidence and epidemic of HIV infection started, and one hospital in Ukraine started to follow up this patient, and I decided to go to this hospital and look at this disease. I asked my curators and they agreed. So 1 month I spent in AIDS department, another hospital. I remember that I thought that patients with HIV, it was in my mind, some different from other humans.
Okay.
I was not afraid this,
Right.
but I thought they are
Right.
different. But when I came to this department, hospital department, and started to help a doctor, I understood that these patients completely the same people. And this was my first discovery about HIV.
Right.
The people with HIV, the
Right.
same like people without
Right.
HIV.
And is that have to do with the stigma and how people were talked about and what you expected? But then when you started working bedside with patients, you realize we're all the same. Is that something to do with it?
Yeah, there were a lot of stigma to patients with HIV, but in the same time, unfortunately, this is still
Yeah.
now a lot of stigma to infection diseases, not
Right.
only for
That's
HIV, because infection diseases, they mostly in countries, poor people. That's why many stigma. And if you want to be infection diseases doctor, you must understand that, for example, your patients mostly will be poor patients with social disaster patients, and you never will earn money, for example, orthodontist. If you want to be infection diseases doctor, you really have to love infection diseases, and also you must
Right.
to love people.
This love of people is something that gives Dr. Lopatina the fuel to provide medical care to some of the most vulnerable and disadvantaged groups in society. As she gained more experience, her career evolved from clinical practice into leadership in the field of infectious diseases, allowing her to effect greater change at a broader scale across the health system. It turns out that balancing hands-on clinical patient care with health system strategy is not as straightforward as you might think. It inevitably came with some trade-offs. I appreciate you saying that. So you mentioned you had that opportunity to work with that doctor in the AIDS department of the hospital, and now I don't know how much period of time had passed where you're now the country director for AIDS Healthcare Foundation in Ukraine. Passion for infectious diseases. You got some exposure to HIV/AIDS specifically through working in the AIDS department, and now it seems like you've honed in on that's your specific area of focus and interest. When did you decide you were going to commit your practice to working for people who are living with HIV? And then how did you end up at AIDS Healthcare Foundation?
I worked with people with HIV about 12 years. Then I got offered to work with AHF, medical coordinator. And I decided to accept this offer because this offer was quite good, and this is important for me. It was that I could save my medical practice. So I continued to care patients in TB hospital. I care patients with co-infection, HIV, and TB.
Right.
Now my career developed, and now I'm a director, a country program director for Ukraine. Unfortunately, I not time for medical practice because I have a lot of responsibilities. I can do some trainings for doctors, for nurses, and this is also very important to give my experience to other medical practitioners.
Does it feel the same? I know it sounds like you miss the one-on-one patient care practice, and then now you're more of a leadership role, building the capacity and building the knowledge. How does it feel to be more removed from the practice? It sounds like you miss it quite a bit.
Yeah, I missed this, but I need to decide what I should to do because I cannot do something in half.
Right. It's one hand there, one hand there. You need
Yeah.
both hands on the same thing, right? Yeah. I understand that. And a lot of conversations we have with people who started their career in medicine, and because of their interests and their talents and ability now in leadership, it's always a bit of a crossroads where you appreciate the impact you can have in your leadership role, but you can never really get away from the clinical practice. So I appreciate that you said that's a bit of a struggle that you're dealing with too, because you want to have both, but you can't have both fully. So I appreciate that.
Yeah. You need to select.
There we go. It's time for Insight Blitz, the segment where we switch things up with each of our guests to get to know them a little bit better as a person. We'll throw out seemingly random questions to get their immediate reactions and responses and see where this all takes us. For this one, I explore a few things with Dr. Lopatina, from her favorite part about living and working in the Ukraine, the most important skill of an infectious disease doctor, and the worst piece of advice she's gotten. Up next. Ready to switch things up a bit? Do something more fun? Yeah?
Nah.
Okay.
Yeah,
Ready?
I'm ready.
All right. So we're going to go into our lightning round, our rapid fire segment that we call Insight Blitz. And what it is, we ask you some questions or read some statements, and then you give us a very brief response to those statements. Ready? All right.
Yeah, ready?
So the first question is, what is your favorite thing to do in your spare time? You're a busy person. When you're not busy, what do you love to do?
I love to go for a walk with my dogs.
Your dogs? What kind of dogs?
Yeah, I have to breed. Yeah, Irish Terrier and Airedale Terrier.
Okay. All right. That's fun. The second question, what is your favorite food?
Oh, my favorite food. It is easier to answer what I don't
What
like.
do you not like?
Yeah. But maybe favorite food is lobster. This is not Ukraine.
Lobster.
Yes. This is not Ukrainian food, but routinely I eat very simple food like soup, salad, meat or fish.
Okay. For the lobster, is there a specific recipe or type of...
No, I eat lobsters only in a restaurant when I outside of Ukraine.
Gotcha. Okay. So speaking of Ukraine, what's your favorite part about living and working in Ukraine?
Maybe my family, my colleagues. Yeah, because I like Ukrainian people. They are very kind and very brave and very smart. For example, my colleagues, nobody left Ukraine when war started. My team now maybe the golden team, and I love everybody a lot.
Awesome. What is the most important skill to working as an infectious disease doctor?
Oh, to be successful infection disease doctor, you need to have analytical skill. First of all, maybe you need to know all medicine, because infection diseases mask other disease.
Right. So that's where the detective, like you said, you have to be a detective.
Yeah, and you must have zero stigma. Zero stigma.
Okay, that's a good one. The next question is a memorable TV show or movie that you watched lately or ever. Maybe your favorite.
No, I never.
You're not a TV
watched
person.
I love reading.
Okay, so reading. Which would there be a
yes,
book that you would recommend that you really like?
Oh, this is very specific book. John Barry's this book about influenza in the beginning of 20th century. Spanish influenza.
Okay, perfect. And the last question I have for you is the worst advice someone has given you.
Of course, sometimes people got me stupid advice.
Let's hear it.
And sometimes I followed these stupid recommendations. But as always, other people give advice, but you have to get out all sequences is this advice. I can't remember what was their worse, but of course I did some
And when you
mistakes in
said
my
so,
life.
some of the stupid advice, do you know it's stupid until you do it, or do you know it's stupid after you take the advice?
After. After I followed this advice.
Yeah. Oh no. Right.
Why I did not hear my heart?
I know. I know. To look back and think about it. Yeah. Okay. All right. Thanks for being a good sport and participating in that. That's the end of our Insight Blitz segment, and we're gonna transition from that into how Ukraine is kind of coping with that and the unique challenges. Coming up next, the final chapter in this two-part mini-series with Dr. Yaroslava Lopatina, where we talk about the beginning of the HIV/AIDS epidemic, how it evolved with the COVID-19 pandemic, as well as the recent invasion by Russia, as well as some barriers to ramping up prevention and treatment initiatives for HIV. That's next time on Combating HIV/AIDS in Ukraine on the Public Health Insight podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.